Well, it's great to be here in the electorate of Bennelong in Macquarie Park with my good friend and colleague John Alexander. J.A., it's great to be in your electorate.
Welcome to the capital of innovation for Australia.
Thank you. And Doug Abdul. And Doug, you've been involved with establishing a non-profit. Can you tell us a bit about that and tell us about what you've done to bring together what it is we're looking at today?
Sure. Well, look, our nonprofit, PNG Purpose, is trying to help some of our most overlooked Australians into jobs, permanent jobs here in Australia. And we're proud to say that under the leadership of some of our best architects here in Australia, we've been able to employ 5 people to complete this project and been able to partner with great organizations like Douglas Hanley Moyer to actually improve the lives and livelihoods of our frontline healthcare workers.
Lives and livelihoods, two very important things at stake, as the Prime Minister keeps rightly reminding all of us. And what you've got here is a piece of innovation in action. So this shipping container, what's it got in it and what's that all been done for?
Well, look, it may look like just a shipping container, but what's really inside of it is something that can be moved to any developing country, any remote and regional area to improve healthcare capacity in those areas. What it's been done for is simply to respond as rapidly as possible to a pandemic that's hitting the whole globe. And as you rightly said, we can't pretend that we're an island in this. So we need to think about not just our entry points, not just what we're doing to secure ourselves, but also our near abroad to make sure that there isn't a secondary wave of infection.
And so this shipping container has all that's needed in it, as I understand it, to support nurses or other medical professionals who may be conducting testing, in this case testing, drive-through testing for anybody who to see whether people may have COVID-19. But the idea, as I understand it, is it can be moved into a whole range of locations and provide that capability pretty much as soon as it's set up.
Absolutely. It's about 72 hours from the word go if we have a secondary outbreak or for any medical response that we might need to move it there. But importantly, because it isn't on wheels, if there is something that's more long-term that we need in, say, again, remote or regional areas in Australia, this could be a real augment to the capacity of those existing healthcare systems out there that could be a long-term impact.
And lastly to you, J.A., you've been a long-time champion of innovation. What do you think about this as an example of innovation in action?
Well, it's an ill wind that blows no good, and this challenge has found champions in our community, albeit we had to import them from the United States. But welcome, say good day, and thank you so much for this contribution, because we are in this together, the whole world. So your efforts here to address this pandemic are so much appreciated. Thank you.
Terrific. Well done, and thanks for showing us a little bit about it. And thank you, J.A.